Can you tell us a little bit about what your hobbies and your self-care practice looks like?
Yeah, my hobbies is like doing fishing and crabbing with my husband, and I always do it because there's something about ocean, like really it calms our mind and things. I think also it helps us about patience because when you crab, you have to wait. So, but there's something really nice, and we enjoy that with not just my husband, but with the entire family. So sometimes we bring our own barbecue there. We grill pork belly and
That's
some made some
amazing.
ramen. It's really cute. We stayed there until like 12 midnight until we're already tired and catch a lot of crabs. So that's one of my hobbies. And for self-care, I like having massage. Like I go to massage to there's like a one cute place near our area. So maybe after a very tiresome job, I always go there with my sister and we enjoy the Thai massage there. And I believe that self-care and having hobbies can help me like de-stress, especially if you're in a work environment where you can easily be overwhelmed with a lot of work. It's very important to have this balance. And I also believe that having compassion does not just extend to patient, but having compassion is also having compassion to yourself. So loving yourself so you'll be able to love or care for others.
Yeah, for self-care, I really make sure that I leave work at work and my home life at home, and I keep them very separate. So when I'm home, that's my own time. And I make sure that I keep active in the community. I hang out with my friends a lot. I like to read in my free time, go to yoga classes, and really just slow down and make sure that I take care of my physical and mental health. And yeah, I'd say that was my hobbies and self-care. I was going to ask, because I saw it on your list of questions, and I was going to ask, like, is there something they're trying to learn through? Like, is this a strategic question where they're trying to figure out, like, X, Y, Z, or is it just like a fun, like, do they
It's like a
actually kind of
fun,
do, like, oh, okay.
like, because you know how sometimes they're like, tell me about something about you that's not on your resume, like that kind of thing of like, tell me something about
Yeah.
you that has nothing to do with your career.
Mm, okay. Um, Something that has to do with me. Like, I don't have anything like that cool. I shouldn't say that. I wouldn't say that to them. I I take a lot of sewing classes and I sew a lot and I do a lot of thrifting and then I I sell it on Depop. I used to
On
be like
what?
a big
Oh,
Depop,
T-pop?
and I would like sell. I do a lot of resale for clothes and stuff. So I'll just
That's
like
cool.
thrift lift it. Yeah. So I'll like if I get a dress and I'm like, oh, this would be a lot cuter if I like brought it in and added this and like cut this off. I'll do that and then I'll flip it and I'll sell it. But half the time, have my friends buy it off me instead because they want it. So yeah, I kind of like part time thrift flip. It's fun. If nursing completely some reason didn't work out, maybe that's what I'd be doing full time.
That's
But
so cool. Say that. So that's the hobbies part. And then the self-care part is you kind of have to give a slight nod to that you understand that while the NICU is amazing and you know have a lot of great outcomes, you don't always have great outcomes
mm-hmm.
for patients, and sometimes the goal, the plan of care and the goal changes to how do we provide, you know, patient comfort and like
Mm-hmm.
a family-centered care as the patient passes, rather than, you know, let's do everything we can to save them. Like when there are bad outcomes, like you have a plan in place kind of thing. Like you don't have to explicitly say that directly, but like they kind of want to know that you get that it can be that bad and you're like here for it and you're not scared of that.
Yeah.
Like that you
Okay. I
journal,
would
you do yoga
can
or
handle.
whatever. Yeah.
Yeah. Would Could I say for one part of it, like I keep work at work and home at home, like because I feel like I am good at like, oh, I'm home now. I'm not gonna think that's work. That's fine. Yeah, like I have a good support system. That's what I'm trying to say. I have a
Yeah.
support system.
You have a good support system and people that you trust that you can talk to.
Yeah.
If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview.
Oh yes. So I love being living and being like physically like living an active lifestyle. So I love to exercise and eat healthy. So one of the things I'm doing right now is I'm trying out new recipes I find on Instagram and TikTok, like healthy alternatives to, for example, like healthy alternatives to like donuts, because I love donuts, as well as just like hanging out with friends and also like taking care of myself, such as like doing like skincare and that stuff, which is like really interesting.
Okay, that's perfect.
I actually really do love cooking and baking and that stuff.
Okay. Well, I mean, I really love working out. I love being outdoors. Golf is my favorite thing to do. And that is the place you really got to clear your mind and just focus on one thing. So after a round of golf, I'm always feeling really good. Also too, just I feel like with self-care, like if I'm ever in like a negative mindset, it's really important for me to kind of shift that negativeness to find something positive. And if there's not really like a positive thing that I can find, then use whatever is going on as like learning opportunity. And that in itself, I feel like, is a positive thing. So, yeah, that's really what I do. I'm just self-aware, take care of myself, read books, work out, golf.
How'd you get into golf?
My boyfriend.
Oh, okay.
Yeah. But I actually really like golf, probably more than him. I'll be like sitting on my phone, like looking at my like swing, like slowing it. Yeah, that's really funny. But yeah, that was kind of something like I felt like if they were to ask me strengths, because I could be like, oh, I'm detail oriented and this and that. But like something that like for me, at least just like my personality is like I am super self-aware and I do make sure that I take care of myself. Like I had a professor tell me once, it's like, you're a cup and you don't want to keep emptying your cup into others until you're empty. You want to overflow your own cup until you're just like overflowing into everyone else's and yours is still full. So I feel like that's just like something like I feel like would make me a really good nurse, because I'm not going to get, I mean, I'm sure I'll get burnt out, but I'll recognize when I'm going to get burnt out and I'll, take the necessary steps to do what I need to do. I don't know.
I would keep that like with this question.
Okay.
Yeah.
Cool.
Okay. So I am a huge advocate for self-care. I've been incorporating it more recently in my life because I've realized that, I can't expect to be able to take care of someone else if I can't take care of myself. So some things that I like to do outside of work involve, working out. I've gotten really into Pilates classes, which are super hard. I always leave every class feeling sore in every muscle group of my body, but it's a great workout. And I also love to cook. I've been cooking more recently with my roommate. She's Indian, so we will cook like Korean and Indian dishes together. I'm a big foodie. I love to go out and try new foods, and yeah.
Okay, cool. When you say that, I'm like, all right, she seems like really mature, and maybe she's going to bring food to the break room.
Yeah.
Yeah, so my hobbies, a really big hobby of mine is working out. I absolutely love movement. Growing up, I was always I grew up competing on a world champion competitive cheerleading team, and I also was on the cheer team in college. And so I really just have this huge passion for moving my body. I think it's a really great challenge, and it's a way for me to de-stress and just disconnect my mind from the work world and anything that stresses me out.
Yeah, so my hobbies and self-care. One of the important things to me right now that I recently started taking more serious is going to the gym. I always think that, well, for one, I think it's important to take care of your physical health, but I think it's also important because it's a big mood booster for me. And as for someone who like deals with a lot of like anxiety or like anytime I'm stressed, I always have that as a resort for me to just de-stress and focus on the task at hand. And I would think it's important in the sense that having those hobbies of gymming, talking with friends, going out to eat, although it's like relaxing and everything, I think there's a bigger importance in that, because self-care is important in the sense that you can't take care of a patient as efficiently as you can without taking care of yourself first. And sometimes I will feel guilty for relaxing, but I think it's important to realize that I need to listen to my body, and I can't do my job as best as I can without taking care of myself.
I like it. Oh, and by the way, with this question, it's not like a deal breaker if you don't, but it's a good opportunity to like make sort of a human connection with them and make them laugh. Like if there's something silly that you like, is there anything like that you could tell them?
Okay, let me think. I feel like I don't have anything like super funny, but I have something I guess would be memorable.
Okay.
I guess basically when I was like filming and before I became like a nursing major and everything, I would film like NFL workouts, and then through nursing experience, I kind of wanted a way to like have a positive impact on others outside of nursing care. So one of my ideas was to start like a mental health podcast, and I wanted to like include like the NFL players I filmed for. I wanted to include nursing students, high school students, about like the struggles that they go through. So I think that would be like, maybe it's not funny, but it's something that I can.
No, yeah, that's cool. I like that.
Well, I already know going into this program that it's gonna probably be one of the hardest things that I'm going to ever do, and I'm ready for that, and I'm excited. And I do have really good resources at home. I have a very supportive family who knows what I'm going through, and I love to take my dogs on walks and get fresh air when I'm stressed, and I have a very stable workout routine. I work out in the morning to just relieve myself of all stress and to just kind of focus on what I need to do for the rest of the day. And it allows me, I'm so sorry, the dogs.
Okay.
I'm so sorry. But yeah, could I say something like that to where I have a really, like working out is my kind of escape from the world, and walking my dogs outside and just getting fresh air helps me really self-meditate and reset myself.
I think hobbies, I would say I really like to go hiking. So whenever I have like some free time and it's actually nice outside, I'll take my dog and go for a hike somewhere, or just go to like the park and just explore, because I'm right big park, so just explore over there and find new areas. And for self-care, I try to choose like one book a month, like a fun book just to read, and take time like nightly to read that. So at the end of the day, after I get like some homework, maybe I won't say homework, at the end of the day, when I get all of the tasks I have done, then I'll treat myself to reading like before I go to bed usually.
That's cute. I like that. Let's see. I don't know if I'll ask this, but do you have any hobbies, or like what do you like to do on your days off, or like what's your like self-care routine for stress?
Oh, so I love going to the gym. I love working out. For me, it just kind of re-energizes me. It kind of releases those positive endorphins, it just kind of relaxes me. I also like going into the spa and the steam room. It just kind of removes all the impurities. I feel so relaxed. I just feel like a weight is lifted off of my shoulder. I really like doing that. And also getting a massage, just being relaxed. These are some of the things I like to do. And just, hanging out, talking with friends or family. These are the things I like to do to kind of like leave my work at work. This really does help me to unwind.
Okay.
What's your pointers on that? What are they looking for?
So I like that if they ask about like a self-care question, if they ask you specifically about hobbies, they're basically saying like, tell me something like completely unrelated to nursing. Like, I want to know you, like, what's something like you wouldn't normally sit. Like, like people, they might say like, I really love to cook, or like I used to be in Cirque du Soleil, or like something like where they're like,
I think the last interview I had, oh, tell me, what do you like to do to unwind? I did get that question. And then when I said, oh, I love a massage, and it was like, ooh, yeah, I love that too. It was just me and the manager and she was like, ooh, yeah, I like that too. Ooh, maybe I should go get a massage. Good idea. Yeah.
Yeah, that's what you want.
Yeah, it was just the two of us.
Yeah, I think a lot of
when
people
they
like
respond. Yeah.
In an interview, you don't see them smile until the end when they're like saying goodbye, and you're like, there you are. Like, I just spent an hour talking to you, and you didn't show me any of your personality. Like, I just caught a glimpse.
Personality has just shown up. You're so. I'm trying not to be.
Yeah.
And I think
you're good
is it
at
okay
like,
to use your hands?
Totally.
Is it okay to use your hands to express yourself? Because I think if I do this, I just feel more stiff and more like robotic. Like I cannot move. I'm confined to this chair. I cannot move.
And they'll be like,
I
what's
like
wrong with
to.
her hands? Why is she doing this?
Move on, because it's like, just relax, be you, be yourself.
I think it really goes a long way.
Don't approach it. Yeah, don't approach them like they're your friends.
Right.
Don't get too comfortable.
I've seen it go the other way too, where I'm like, oh, that was risky.
I don't want to do that. Keep it professional, keep it light, and just stay focused. Okay.
What if they ask you about your hobbies and your self-care? Like,
I am kind of like hobby junkie type, but I love outdoor. I love mountaineering. So I do backpacking, I do camping, fishing, anything that sort. So it's been, I mean, I'm like kind of easygoing in a way. I don't need anything. I can just walk outside and I'll be happy. Something happen. So yeah, that's pretty much my hobby. I do, road biking. If I need hours to kill, then I'm gonna just do it. But it really helps for me to clear mind when I go outside and be in the nature.
Yeah. I have something for all of you that I'm very excited to finally tell you about. It's something that I've been working on for over a year. And this is great for nursing students who are just starting out. This is also great for the person who has an interview in a few days and is trying to put all of the pieces together so that they can be organized and confident going into their interview. And it is my solution to what I hear from all of these nurses that you see in these videos. They all tell me, I know something like that happened, but I can't remember it now and I wish I'd written it down. I know a lot of clinical instructors and nursing professors encourage people to write down their clinical experiences so that you can remember them later, especially when you're in front of a hiring manager interviewing for your dream job and it's something that happened, months or even years ago, and you want to be able to articulate it well. It can be so valuable to have everything written down. So I've made it's a hybrid between a clinical journal so that you can save all of your memories from clinicals, but it's also divided up by question. So for example, let's say you had your first rapid response that day, you would flip to the question section that says, tell me about your most critical patient. Write down everything that you can remember, while you're waiting for post-conference or whatever it is, whenever you have a few minutes. And then when you finally get that call out of nowhere asking if you would be open to coming in for an interview for your dream job that's in 2 days, you have everything organized. And then it's also a nice thing to have looking back, remembering all your first patients and the first time that you did all these different skills that you're learning. So I have tried to make it all cute and aesthetic for you guys. It also includes why they ask certain questions, what they're looking for, do's and don'ts for answering questions, and then it has clickable QR codes so that you can watch examples of how other people have put their answers together who've been successful in getting the job that they wanted through their interview style. So it is about 250 pages. It's also meant to be sort of a how-to DIY version of the online one-on-one coaching for situations where you may not necessarily want to hire a coach for your answers. It is a fillable PDF. It also has other sections like, frequently asked questions, things like what should I wear? What do I do if I'm nervous? What should I put in my portfolio? I could talk on and on about this thing. I've worked on this, like I said, for over a year. I'm really excited about it. It's finally available. I do have a discount code for supporters of the channel that is currently for 50% off if you use your discount code.